They're working hard to improve Michigan's overall health. Hello and thanks for joining us. I'm Laurel Hess and this is Comcast Newsmakers. Our topic today is the Healthy Food Hospitals campaign. Here to discuss it with us is the Executive Vice President of Operations for the Michigan Health and Hospital Association, Brian Peters. Thank you so much for joining us today.
It's a pleasure. Thank you, Laurel.
What exactly is the Healthy Food Hospitals campaign?
Well, about a year ago, the Michigan Health and Hospital Association identified obesity in the state, particularly child obesity, as a real public health concern that we wanted to address, and we wanted to address it proactively by improving the offerings in our Michigan hospitals statewide. We have about 140 hospitals in the state, and in many of our communities, the hospital serves more meals on a daily basis than any restaurant in town. And so we have an opportunity to lead by example and to improve both the beverage and food options for our patients, our visitors, and our employees.
And have you been able to do that in most of the hospitals throughout Michigan?
Absolutely. Currently we have well over 100 hospitals that are involved with our Healthy Food Hospitals campaign. Ultimately, we hope to have 100% of our member hospitals throughout the state involved. We're partnering with organizations like the Michigan State Medical Society and the Michigan Osteopathic Association because physicians are critically important in this venture as well.
Recently, in his State of the State address, the governor announced something called the Pure Michigan Fit campaign, which sounds very similar to your campaign, but perhaps on a larger scale.
Indeed, and we really do salute the governor for his leadership. When we made progress in terms of our smoking rates in the state, it was because of culture change over time. We think to address the obesity epidemic in the state, it's going to take a similar culture change, and having that leadership at the very top is going to be critical. And so when the governor launched his Pure Michigan Fit strategy, it gives us yet another opportunity to broaden that message beyond the hospital setting to our communities and really set the stage for what we think can be an improved public health dynamic here in the state.
Will you be working, do you think, your association closely with him as he asked you to sort of help him as he sort of formulates this campaign? Because I know he's in the very beginning stages.
That's exactly right, and there are a number of organizations, associations throughout the state, in addition to the Michigan Health and Hospital Association, that are going to partner both here in Lansing at the state level in a coordinating fashion, providing resources and expertise, but I think even more importantly at the community level where the rubber meets the road, where patients come into the hospital setting or come into a physician office setting. We have an opportunity to have that dialogue with parents and with children to model the correct behavior in terms of their dietary choices that make such an enormous impact in their health status and, quite frankly, our health care costs over a long term.
Is that what it really sort of gets down to? I mean, obviously we all want Michigan residents, especially children, to be healthier, but the whole impetus behind the change, it would be to cut down on healthcare costs and make the economy in Michigan perhaps better because we don't have so many health issues?
Exactly right. Employers don't want to locate a new branch office or a new plant in a state where they know they're going to face very high health care costs. And by looking at readily available public health data, we understand that Michigan currently is the 10th most obese state in the nation. We want to get an early start and address our childhood population first. If we can model the correct behaviors there, it really portends better outcomes over the long term. We need to engage in things like modeling proper intake of milk, use low-fat milk as opposed to what we call the high-test, fully leaded variety. We want to minimize the intake of juices. Those are very calorie-intensive for children. And we want to have fresh fruits and vegetables as well.
All right. Thank you so much for joining us today.
Thank you.
Today's Comcast Newsmaker was Brian Peters, the Executive Vice President of Operations for the Michigan Health and Hospital Association.